Continue our coverage, the first couple being diagnosed with COVID-19 by talking with several doctors this morning. Our third one, a medical doctor. Many have questions about the diagnosis, the president's health, and again, contact tracing. Joining us now is Dr. Ram Uledi with Community Health Network to try to help us understand a little bit more. Good morning, Dr. Uledi. Thank you so much for joining us.
Good morning.
Yeah, we've been kind of trying to get different people's perspective here because even though within the field, different doctors have different opinions and they treat folks differently. President Trump is 74 years old. He tested positive for COVID-19. First, what is your general reaction and what would you be saying to him if he was your patient?
I think the most important thing for him as a patient is to remain quarantined and take care of himself. There's a risk of infecting others, so the most important thing is to stay at home in the White House, at least for the next 10 days, and try to keep the schedule as light as possible.
What would be some of the first signs and symptoms if he was feeling something? Right now we're being told that he's basically asymptomatic. Would you expect that continue, or is it just so different for each person and how the virus is affecting them?
Yeah, that's the thing. About 40% of people that get the virus don't have any symptoms at all. 60% can, and as you probably heard, there's a whole variety of symptoms people can get, being mild, like maybe a sore throat or cough, high fevers, and the most common symptoms is loss of smell, loss of taste. So it could be a whole host of them. Then, of course, can get severe shortness of breath, requiring hospitalization as well.
So far, we understand that Barron has tested negative. He's young. We know that for someone his age, a lot of times they are asymptomatic, and then survival rate's extremely high, 99% or so. Someone President Trump's age, even though if they were to get it and be serious, I believe the survival rate for him is even in the 94 percentile. Is that still a correct stat there?
Yeah, I think the highest risk patients are those above 85, but also even at his age, it depends on his comorbidities, what other health issues he has. If you have significant obesity, diabetes, or hypertension, any of those can also increase your risk of having significant issue of being hospitalized or even dying from it. In general, I don't think he's at the highest risk category, but he's definitely higher than the average person, though.
All right, and also I'm hearing from the Associated Press that he is now reporting mild symptoms. There have been some people that have been traveling with him that said that they noticed that he may have seemed a little bit tired, but they thought that maybe that was because he'd been traveling so much. We hear a lot about fever, we hear a lot about cough, but also just feeling a sense of kind of feeling exhausted. Isn't that also a symptom?
It's a very classic symptom. Unusual fatigue and sleepiness is very, very typical. So I would take that as a true symptom that the president has, that if that's the case.
What would you want to leave everyone with this morning in the last 30 seconds of another doctor had tweeted just a little bit ago is like, hey, everybody, don't panic. What would you say, though, to someone?
I think the most important thing is not to panic. His likelihood of battling this is actually very high, not zero, but very high. But the most important thing, again, is remember that we have to always keep our masks on. The most common thing with this is best way to protect it is from not by social distancing and wearing a mask.
Yeah, all right, we will continue to do that. We know that we heard earlier too that the virus is still basically everywhere. Wash your hands, don't touch your face and your eyes, wear your mask when you can. Thank you so much. We appreciate your time.